doesn't mean it's stable and it's never going to change. Things change. If your chronic condition is great, you probably don't need that much monitoring. If it's not great,
I'm excited to chat to you a little bit as an amazing doctor that's working with us here at DrHouse. Can you briefly introduce yourself, your background, and what you focus on clinically?
Dr. Chandler, I'm from Pennsylvania, trained in family medicine since 2008, I guess, whatever the math would be, 15 years or so. Started doing, the first 8 in person, did some urgent care, and then the last maybe 4 years exclusively telemedicine.
Dr. Chandler, how often should chronic conditions be reassessed?
Every condition's different. It also depends on how serious it is, right? Did you have an organ transplant? You might need a little bit more frequent labs and checkup. If you have cancer, well, again, let's check that out, every year. If you're super healthy and no medical conditions, you might not need to be checked on that often. And again, there are some things every 5 years, 10 years, typical routine female care, colonoscopies, or if something's hurting you, obviously, then we might want to check on things. We were mentioning the medical costs. All things considered, I might want to check your blood work once a year, but hey, doctor, I had to pay $400 for that lab. So that would be an example where it's not that important. Maybe we'll check it every 5 years. So I always tell my patients, because medically that's one thing, and then the cost is another.
Is there anything in chronic care that could trigger a reassessment?
Things change. If your labs have been normal, if your tests have been normal, and all of a sudden now they're not. You were good before, but something's different. So now let's not just go 5 or 10 years. Let's check in a couple months then maybe if it's more serious.
When someone is, let's say, stable in their chronic condition, they've got cholesterol, but they're managing it. Does stable always mean that nothing can ever change?
Exactly. Things could change on their own. Sometimes the patient could have done something, maybe intentionally or unintentionally, to change that. Like I said, sometimes you move, lifestyle, job change, certain things could affect things, stress, or maybe you did nothing. Hey, nothing changed in my life and all of a sudden my labs are different. Doesn't mean it's stable and it's never going to change. And that would be more rare, quite frankly. I think things typically do change. And it's more rare that things never change.
That nothing does change. Are there any medications that actually just stop working well after a period of time?
Usually medicines are pretty good. Metabolism and aging would change things. As you get older, your metabolism might change, or if something changed in your life. But typically they're not going to spontaneously stop working. Like my blood pressure medicine worked and now it's not. So usually they keep doing their thing.
So how often should someone with a chronic condition, so either high blood pressure, diabetes, or cholesterol, talk to a doctor and start reassessing their medication?
Like I said, how well controlled it is would answer that. Chronic condition is great. You probably don't need that much monitoring. If it's not great, I guess number one, back to that, do you want to change it? Is your diabetes super uncontrolled? Your A1C is like 10 or 12, should be 7 or lower. I think we need to adjust medicines. You really should be getting labs every 3 months.
When it comes to chronic conditions, what can be done virtually versus what does someone actually need to come in face-to-face to see a doctor?
A really good utility is follow-up. Obviously, there's some things that have to happen in person, testing, labs, things like that. But once you have a diagnosis, sometimes finding the specialist or going to them, if they're a drive, they might be booked weeks, months out, and a lot of cost and waiting. You have to wait an hour for the doctor in person. Once you have that diagnosis and the conditions identified and maybe stable, then I think we're really good at monitoring. You can talk to a doctor. I can jump in. Maybe you had a test and you just need an interpretation, or you need a blood test, or just an order here and there, or just a referral. We could do all of that virtually, and that's very good. But identifying it from square one, a little bit harder. Again, we can order blood tests and referrals that might get those diagnoses, but I think monitoring and following is a lot better.
So how do doctors decide what's safe then to manage remotely?
It's always a personal thing. Obviously, platform plays into it too. Whatever the doctor training is, nurse practitioners, physician's assistant might not have as much experience with this or that. Maybe they worked in a specific field and they might not be as prepared or as well versed in that. They might suggest going to the urgent care ER more often than someone like myself with worked all of family practice. I guess it's a flip side too. If somebody comes in with cancer, maybe I'm not the cancer doctor. I'm a family doctor, so I would easily triage that. Hey, I'm sorry, go to the cancer doctor, go to the ER. I'm not equipped to handle that.
So I know DrHouse does have a guarantee that if we can't treat you, we actually refund you. For instance, if you need to go to urgent care or there's an actual emergency. How do you feel as a doctor when you see a patient like that you physically can't help? And then knowing that they're not going to waste their money basically on this visit.
I love it. That's exactly what a company should do. I've worked on companies that don't do that. From a patient standpoint, that is not helpful, because sometimes I'm surprised at how expensive some of these visits can be when it's not a DrHouse kind of platform and maybe they don't take insurance. Some of these visits are $100, $200, and for 5 minutes, and I can't help you go to the ER. Patients will get very mad if they're not getting a refund. So I definitely think that's very good patient care, to refund them the money if we're not helping them.